I too am going through a healthcare, as you know, journey, and I feel it feels like you have to like stand up for yourself. And I am a recovering people pleaser who is trying to stand up for herself with such an invisible like illness at the same time
Mm,
that when I say invisible, it's really hard for people, even healthcare people who you would think would be on your side in general, right? To actually like hear what you have to say. And I think as a woman, it's even harder because we've put everybody else and we put ourselves on the back burner. So to have to like stand up for yourself or to ask for help or to, I don't know, be vulnerable with any kind of that. And I think of you, it is hard to do. It's hard to document something that all your life you haven't talked about or that people feel is like a weakness. And I think
mm.
that brings up an emotional part of us that then feels so emotional and so like raw. We easily project it on the people that are around us. And luckily, I've caught myself a couple of times and I've asked for grace and forgiveness, but I found myself in that same spot the last couple of days.
Oof. Yeah.
And I wanna flip the tables.
Yeah.
I wanna, I don't even know if we will. We're gonna go. I'm gonna go here and maybe we won't even show this. I don't know, but
Yeah.
I feel angry and I feel mad and I feel upset and I feel disappointed and I also feel ashamed. I have migraine headaches that started because of such a wonderful thing. I had a kidney disease that I didn't know about. And so when I got pregnant with my child, we found out that I had a kidney disease and I lost my kidneys in 5 years after having my child. An amazing person gave me her kidney and another chance at life in 2008. And that has always been like a hero story for me. And I've tried so hard to live up to that gift. And I've been a good patient. And, you know, with that comes, you take medication for life. And those medications sometimes have side effects. And I'm dealing with one of those side effects, but it seems like the side effect is so invisible that I'm having to like fight for everything. So I get migraine headaches and I can't take anything for pain. Not that I want pain drugs.
Right.
I want to make that clear, but it makes it a little bit harder because I power through pain. That's maybe that's a sign that I shouldn't even be saying any of this.
think,
I'm just upset. I'm
yeah.
upset for not being believed by healthcare professionals. I'm upset to have a doctor that I love for so many years not listen and say
Mm,
not it. I'm upset at men who think they know exactly in the neurology department what is happening inside my own body. And I'm also upset at the arrogance. I'm disappointed in the fact that there's not enough women in neurology. I'm grateful for the physician assistant that I have that actually listens to me. But it's like trying to tell, and it's like, okay, you have a headache. What can you do? You cannot go to the emergency, you cannot go to the urgent care because they can't take transplant patients because you probably have to have an infusion. You have to go to the ER. The ER puts you at the bottom of the list because they believe you just have a headache. So it doesn't matter if you've raw dog through pain for years and years and years. You,
mm,
it's just, I don't know.
mm. It's painful.
It's
Not,
painful.
I mean, emotionally painful. I mean,
It
of course,
is.
physically painful, but it's emotionally painful. You feel not believed.
Yes, to be not believed. Yes, to when you stand up for yourself, you look like a crazy person trying to stand up for yourself to doctors that won't believe you. And then those doctors call the social worker, who then calls you on the phone and tells you you might have depression. You have never even seen me. You don't know who I am. I am not depressed. I am in pain. PAIN.
Yeah,
In a
I'm in
world
pain.
that doesn't believe in migraines, chronic migraines,
Right. Where you're like,
and
I've had a
a system
migraine for 20
that
days.
doesn't support
Mm,
anybody with migraines, you know?
hmm.
And to be told by a doctor, I don't know what you want me to do for you. You take a medication that eats your brain. So what do you want?
And then this doctor over here says, this
Not me.
medicine is keeping your kidneys happy, so not my problem.
Yeah.
Not my, not, what is it? Not my something, not my circus, right? It's like, not my monkey, not my circus,
Yeah.
not mine. And you're like, so whose is it?
So whose is it? Yes.
Hmm. Whose is it?
It's constantly being judged by other people, I feel. And
Yeah.
you know what I mean? It's just constantly having to stand up for yourself and stand up for yourself. And I get that. That's what my lesson has been for the last 3 years.
Hmm.
Standing up for myself. I get it. I get it. I get it.